Welcome. Thank you for joining us this morning. We're going to hold just about a minute or so here as we approach the top of the hour and just make sure that everyone is able to get in from the waiting room. And then we'll go ahead and get started this morning. In the meantime, as you are able to join and connect and make sure that you are able to see the screen that is being shared right now and that your audio is working. In the chat or also using the QR code that you see on the screen. We do have a demographic survey. If you would like to fill that out, that's something that can be done while we wait for the meeting to start here. I think I'll just give to about 10:01 and then keep moving forward. Scott, does that sound like a okay plan? Okay, good deal. And Patty, let me know if you feel like the waiting room is still really full at that point too. We can always hold a little bit longer.
Okay.
If you're just joining, welcome. We're going to start here shortly. Make sure that you're able to see the screen and your audio is working. There has been a link that's been shared in the chat, which is a short demographic survey if you'd like to complete that. You also can use the QR code on the screen and that will take you to the same survey. And then again, those who are at peer support centers, you're welcome to also use the QR code, but you have paper hard copies as well of that survey on hand at each center site. All right. Patty, Paulina, how's the waiting room looking?
I don't see anyone else at the moment, so we may be good to start, but
okay,
I'll leave that up to you.
No, we'll continue to move forward. We have a few more introduction slides, so I think that will give time for a few others to join. Well, welcome again. Thank you for joining us this morning for the Lake County Mental Health Services Act, or MHSA, as we'll say many times this morning, community planning meeting. This is the second of 2 community planning meetings. Many of you probably joined us in early February for community planning meeting number 1. And so this is the second in that process as part of the annual update creation. And again, like in community planning meeting number 1, we have a good sized group who are all able to join today, and also a lot to share with you and content to cover. And we want to have opportunity for questions and conversations. So we don't have time to do full introductions here at the top, but what we will do is ask you to share your name, program, what brought you here, pronouns in the chat so that we know who is all here in space together. Special thanks for our peer support centers for also supporting space for everyone to join this morning. So welcome there. There are sign-in sheets that are available. And thank you for those who have updated their name on the screen too. We're really glad that you're here this morning. And if anyone is also just joining, in the chat where names are being shared and introductions are starting to happen, there is a link for a demographic survey. If you would also fill that out for us, we would be appreciative. Thank you. Okay, a quick overview of our agenda and objectives, and then I'll pass to Lake for welcome as well this morning. So what to expect from our meeting today is really a continued overview of MHSA training and education. So the Mental Health Services Act will provide some background as well as what the annual update is and how that pairs with the community planning process. We are going to revisit and do another overview on the MHSA modernization. That was Proposition 1 that was on the ballot in March, and just review what that entailed. And then a large part of our meeting this morning is actually sharing with you all the community needs assessment findings. So we'll go into more detail at that time, but following that, we'll have the opportunity for questions, conversation, continued feedback into that community needs assessment. We'll take a break and then we will have those breakouts and share outs. So that's really what to expect this morning. We'll also reflect on the continued timeline and any other upcoming dates as part of the annual plan development. So some of our objectives for sharing with you this morning are really, again, to provide an opportunity for you to review, discuss, and continue to give information into the community needs assessment, and continue to identify opportunities for program changes to best meet community needs. So this last piece is just kind of a reminder in our hybrid environment here. If you are on Zoom, keeping yourself muted while others are talking just kind of helps with background noise. And so just some Zoom tips there to continue to make our space impactful together. All right, and we are going to have opportunity for sharing today. And so just a reminder of the different ways that you can participate and share as our meeting progresses. So with that, I do want to just hand over to Scott for a welcome from Lake this morning as well.
Well, thank you. Appreciate our fine team from RDA here to kind of guide this process for us. My name is Scott Abbott. I'm the program manager at Lake County Behavioral Health Services for the Mental Health Services Act and Housing. And just wanted to express that I'm really appreciative of the time you're taking to be here. This is extremely important for our department, for our community, as the input that you provide, the feedback that you give, really guides us in the formation of the plans and the annual updates. MHSA has been and will continue to be very community driven, where the community helps recognize what the needs are, where improvements need to be made, and we take that feedback and put it in our plan and try and implement it. As Courtney said, the first meeting we had, that meeting along with the survey that we did really gathered a lot of information. The purpose of this meeting is to present that information to you, to give you, let you know what's been found, and maybe ask a few follow-up questions, do some refinements of the data that we discovered. We also want to take a chance maybe to address some of the findings which came, and then we want to spend some time also looking okay, from the data we've gathered, where do we go from here? And so that's really the purpose of the meeting. We're going to do some, as Courtney mentioned, a little bit of education. We're always required to do that. That's one of you probably have heard what MHSA is 1,000 times before, but we have to do that. That's part of what the state requires, to make sure everyone is on the same playing field when it comes to what their background of what MHSA is. And then we're also going to talk a little bit about Proposition 1. And so I'll turn it back over to Courtney.
Great, thank you, Scott. And I know a few have joined while we did the initial introductions this morning, so welcome. Thank you for being here with us. If you are just joining, please, you are welcome to share your name, your organization, what brought you here, pronouns in the chat this morning. We'll have some opportunity with breakouts later this morning to do a bit more of introduction there, but please share that in the chat. There also should be a link in the chat, and we can share that one more time if you're just joining so you can see it. And that is for a short demographic survey if you would like to complete that this morning. Okay. Well, then with that, as Scott noted, some of you, this maybe is a refresher or hearing it for a number of times. Others, this might be new information. But just to kind of set the stage for what is the purpose of the Mental Health Services Act, what does it entail? Why are we doing the annual update? And then where that needs assessment will impact. We are going to go back over some of those details this morning. So when we say MHSA or the Mental Health Services Act, what this is it's a proposition that was passed in 2004. It is a predominant funding source for many counties for mental health services. And it is unique to California. It's a 1% tax on income over $1 million to expand and transform mental health services. So it's a tax on individuals who have over that earning. And it's really based on 5 core values and guiding principles. And so you kind of see those in the boxes there, but what that really entails is proactively ensuring individuals are not deteriorating before they are able to receive services. So really promoting a recovery vision that is centered around hope and personal empowerment, respect, building social connections, and self-responsibility. So really building that up, centering those services and supports on those with lived experiences to really drive service planning forward and their families. So being really client and family driven, expanding and initiating new innovations in mental health services that are also culturally and linguistically sensitive, and really ensuring a prioritized focus on equitable service delivery. The other is continuing to support access to a full range of services provided by multiple agencies. So integrating service experiences and making sure that there's really good community collaboration in providing services, in planning for services, and reaching out to community. So when you look at the Mental Health Services Act, there are 5 key components to that. And so the first is community services and supports. So this is kind of the percentages there are the funding structure and the funding that comes to counties where that is used. And so community services and support is outreach and direct services for serious emotional disturbances or serious mental illness across all ages. Half of that funding for community services and supports goes to support full service partnership programs. The next one is PEI, or prevention and early intervention. And again, this is preventing the development of mental health problems and screening for and intervening with early signs of mental health struggle. With this, half of PEI funding, so you can kind of see the percentage that goes to PEI, half of that funding is really intended to go to children and youth services and a wide range of that. Then there's this innovation piece, and innovation is really about one-time funding meant to support learning, research, pilots, other type of innovation programming that local counties want to explore and serve to meet a unique community need. And then that becomes integrated into other services moving forward. And then there's 2 other areas of workforce, education and training, and capital facilities and technology needs. So counties can use up to 10% across those as needed, and that looks unique to different counties. So thinking of those core pieces and really looking at what is entailed in them, you'll see here kind of longer lists with community services and supports and prevention and early intervention. Oftentimes there are aspects that are supported both through both CSS side and PEI. And so you'll kind of see some repeat between those. I won't read over that list, but we'll just kind of leave this here for a minute and slides will be available. But these are all of the ways that those fundings are actually being used, that funding in Lake County to support Lake County services, programs, and resources for community members. Okay, and so that's a really high level overview. We're going to continue to look at mental health services act from what the annual planning is and get a little bit more in depth there as part of our training and overview, but also just want to pause for a moment and make sure that you have this website as a resource. So this is directly to Lake County, their Mental Health Services Act MHSA website page. And this is where you can continue to reflect on what I just shared or learn more specifically about that background and knowledge from Lake County.
It also has a description of the different programs that we have.
Perfect. Thank you, Scott. Okay. So what really brings us here today and part of this community planning process is the annual update. And so as we think about that, the purpose of what the annual update is, this is really to provide updates to the adopted 3-year plan. So many of you in the room may have participated in similar meetings or focus groups or survey work a year ago when Lake County put together a 3-year program and expenditure plan for the years of 2023 through 2026. And so this annual update is providing an update to that. It's going to share program status and service accomplishments from the 2022 to 23 fiscal year. And then it's going to address any program changes or updates that might be expected in the upcoming year. And those are based on the needs assessment, conversations like this that we'll have today, and those other community engagement points. And so part of today's meeting is really part of the community planning process. So the Mental Health Services Act requires robust community engagement and having a wide range of community voices and stakeholders as part of that process. And so this is one of those opportunities to provide just that local feedback, what services are impacting and where are those needs continuing. Another part of that annual update is the Prevention and Early Intervention, or PEI, evaluation reporting. And so this is an evaluation report that began in fiscal year 18 to 19. The Mental Health Services Oversight and Accountability Commission requires this report to come in, and this provides annual updates and shares who was served by these programs. It also collects and shares demographic information and key accomplishments that were happening during that past year. And so I think I mentioned with the community planning process that is really meant to engage a wide number of community members, organizations, stakeholders, really anybody who touches the greater mental health and behavioral health system. And so this is just a list of some that might involve. And every community, again, has different organizations, nonprofits, stakeholders who are part of that system, but really ensuring that there is robust representation across all of those partners. And so when we think about all of the different stakeholders and partners and organizations that are part of the process, this is just a summary of who are those really roles and responsibilities and who are those individuals, what are those responsibilities. And so community stakeholders are really charged with being able to share and having opportunity to share perspectives, their lived experiences, reflections that they have of what emerging strategies might best meet community needs. The Behavioral Health Services Department, so Lake County Behavioral Health Services, really is charged with developing the annual plan as well as the 3-year plan that the annual plan responds to, and ensuring that it is reflective of community needs, priorities, and identified strategies. So making sure that it is informed by the community program planning process. Then the Mental Health Advisory Board, again, has an assurance role in making sure that we have good stakeholder involvement. They review the annual update and they will conduct a public hearing. And we'll talk about some of that timing at the end today too, so you're aware of those upcoming periods of time. The Board of Supervisors ultimately reviews and approves the plan, both the annual update as well as the 3-year plans that happen. And then with RDA Consulting, our role is really to support the needs assessment and plan development with Lake County. So looking at that overall timeline, again, we looked at this, we've moved a little bit since our community planning meeting 1. But December through January, February was really a time of foundation setting, preparing for that community planning. In early February, we had that first community planning meeting. Also at that time, launched a community survey and other opportunities to provide that feedback in. Have now spent some of that time analyzing that feedback that was received, the survey responses that came in to provide that needs assessment summary, and we'll be going over that today. Today, we're presenting that and then having further opportunity to add additional context, notes, experiences that maybe are captured or not captured there, and you want to continue to feed into that process. And then after today, what we'll really be focused on is working on the annual update itself. So kind of synthesizing what are the past things that have happened for programs, what are the things that will happen moving forward. Okay, I'm going to pause there. One, I want to check with Scott. Scott, anything else you would want to add to that before we open the poll?
No, that's good summary.
All right, good deal. So now, as Scott mentioned, this is a required part of training and education and making sure all of our partners are aware of what MHSA is and how that is supported as we then have conversations about what the local need is. So we're going to put a quick poll in the chat. And if you can just give us some feedback on where that training landed, if you learned something new, and that helps us continue to improve that as we provide it to you in the future. And that link is in the chat if you're not seeing that. So you're able to do that there. We'll just wait for about another 30 seconds. I see a lot of people who are responding to the poll right now. And for our peer support centers who may not have the poll directly, a show of hands to maybe answer that in unison together would also work to respond to that poll. All right, we're nearing higher percentage, maybe 15 seconds more if you want to complete that poll and answer that question there. Okay. Oh, a few more coming in. All right, looks like it's slowed down. Thank you for doing that. Okay, so now that we've reviewed the Mental Health Services Act and provided an overview and background there, we want to spend some time revisiting the MHSA modernization Proposition 1 that was on the March ballot and just kind of loop back on that. I know we covered that briefly when we met in February. I will just give the caveat, our update isn't a lot different today, but we do want to make sure that we cover those key pieces. And we'll have some time before we shift out of this area for some question and answer to do our best to answer questions or make sure we note those and help find answers as they become available. I'm just going to pause. I've seen a few people coming in from the waiting room, so welcome. We're glad that you're able to join today. If you can share your name in the chat and organization, what brings you here, that would be lovely. Thank you for doing that. And we're just moving into an overview of the Mental Health Services Act modernization, or Proposition 1, that was on the March ballot. So Proposition 1 is an initiative that was proposed by Governor Newsom to modify the behavioral health system. It was emphasizing the expansion of housing and treatment options for those with serious mental illness. This was on the March 5th ballot, and Californians did vote to pass Proposition 1 to modernize the behavioral health system. What this entailed was 2 legislative bills, and I'll show those in the next slide, that created essentially the language of Proposition 1. So there was the Behavioral Health Services Act, and then the Behavioral Health Infrastructure Bond Act. So Proposition 1, kind of in summary, what that is intended to do is evolve the Mental Health Services Act into becoming the Behavioral Health Services Act. So there will be kind of a name shift there. It allocates funding to provide services to those with the most serious mental health conditions and or substance use disorder. It does update MHSA funding allocations that come to counties by and also the ways in which counties can spend that funding. So we'll look at that here shortly. But it updates those funding allocations by increasing support for housing interventions and workforce investments, continuing to provide some flexibility for use of services and resources for local needs. It also allocates $6.4 billion in bonds to build roughly 11,000 new behavioral health treatment beds and supportive housing units, as well as to increase outpatient capacity to serve people annually. Let me move here. So the 2 areas that it updates, I'm showing you here, kind of those 2, the Infrastructure Bond Act and the Behavioral Health Services Act, so SB 326. I won't review that, it's what I just said, but those are the 2 aspects and the major components of what are really providing mental health care and drug or alcohol treatment to people and addressing homelessness. So that's the shift there.
Can you get back in if you could sign that and then fill out?
What I want to spend a little bit more time is kind of showing the allocation shift. So the first chart that you see there is what the current allocation is, and the other is the proposed. I think one thing to note, this is more a shift of where the funding is going and the categories in which you can use that for. So some of the names have been updated. I'll go over that. It is not a change in the overall tax itself. So you'll remember we talked about that was a 1% tax on millionaires, anyone making 1 million and over. So this is no change to the tax itself. It's still a 1% tax on millionaires. But at this point with the shift, more of that is going to the state. So that's now at 10% instead of 5%. So 10% of the total behavioral health service funds, or MHSA as we know it now, will be used to create statewide and state-led programming. That's further broken down, 4% to prevention programming, 3% to workforce investments, and 3% to statewide oversight and monitoring. The allocations to counties is also changing. You'll kind of see those names and titles have changed in the orange, red, kind of yellow circle that's there. 30% is now for housing interventions. This is a new funding category. It's intended for children and families, youth, adults, and older adults who have substance use or other mental health co-occurring issues and experiencing homeless or maybe at risk of homeless. 50% of that must go to people who are chronically homeless. And then up to 25% of that kind of bucket area of how can go to housing intervention funding and developing housing units or other type of infrastructure. The other, so 35% is to behavioral health services and support. So really this is essentially combining the monies that were allocated to prevention and early intervention. So that PEI, innovation, and really pulling those all together. This includes intervention, outreach, engagement, workforce education and training, capital facilities and technology needs, and innovative projects. Of that, 51%, must go to early intervention in the early signs of mental illness and substance misuse. And 51% of that must really be serving children and youth ages 25 and younger. And then the other category is full service partnerships that you see there. So 35% to full service partnerships. So this is similar to what was going to full service partnerships before, because half of the community services and supports did go to full service partnerships. So it's intended to expand full service partnership spots across the state. And then counties may move up to 7% of the funding to other categories to best address local needs. So a little bit of local decision making there. The next slide I have is more of a rough timeline. I know it's not possible to read on this slide, so I'm gonna, we'll make sure that that is posted. But really, with that passage, just kind of a brief note on what comes next. The Department of Healthcare Services is intended to begin policy development and guidance to support counties in fulfilling the statutory requirements of the initiative. That guidance is expected to be released in phases, so we don't have all of that new information since we met in February. And there is intended to be opportunities for stakeholder engagement throughout that policy development process. I'm going to pause there. Scott, do you want to jump in and say anything about that or add any local context?
Sure. With the passage of Proposition 1, as Courtney mentioned, MHSA will become BHSA. That's just like probably the smallest change. There's going to be, a lot of potentially required changes. The good thing, or I guess we could say it's the good thing, is that our current 3-year plan, which we are just finishing our first year of our 3-year plan, can remain in effect. We can start to make changes as far as switching over to BHSA in next year's, which would be 25, the start of that fiscal year, July 1st, 2025. We could start making spending changes if we chose to, but we can also, we have the option of this, keeping our 3-year plan, which would go through the end of that year of 25-26. So officially would start July 1st of 2026. So that's one thing to keep in mind. That's one thing that we'll need to discuss as a community, what we want to do. Again, as I mentioned earlier, this is all community driven. We also have the option, which we don't know a whole lot about, of exempting ourselves out of some major components of not all the components, but some components of Proposition 1. The biggest one being that funding reallocation, which Courtney just shared on the previous slide. We have the option of essentially staying the way we're presently doing it. There's a bunch of other requirements which also go into it, such as the state taking 10% instead of 5%. That's not going to change. There's a whole lot more transparency and reporting requirements that BHSA requires. Those aren't going to change. Will this be this funding allocation of the 35, 35, 30%, which could change, or we could remain the way it is.
Thanks for that, Scott. I'd also, we're getting a lot of support, like all other counties, from the California Behavioral Health Directors Association, who is gonna walk hand in hand with DHCS to support the operationalizing a lot of these changes. Presently, we're definitely considering going for the small counties exemption, unless, of course, there's compelling feedback from the community about why not to do that. So at this point, it would be my preference to maintain our current funding structure, but again, community feedback will prevail. Right,
and that's what the purposes of these meetings is, to get that feedback from you all. I mean, the one community feedback that we did get overall was the election itself, where the results were the Lake County did not support Proposition 1, the majority. So that's a little piece of feedback that we've already received. But we'll want to fully discuss what our options are with the community. I think what we want to do going forward from this point, particularly for this update, is we want to stick with our 3-year plan. We can't do any new spending for another year anyway. And so our current course that we're taking for update will not change. We'll continue to talk about the funding as it is in that top right-hand corner as we are making plans for this year. Is there any questions that people have at this time? Okay, interesting. Either we did a good job answering, or or I'm not sure, but hopefully I just want to make sure. I want to make sure you all understand where we're at as far as Proposition 1.
Just a reminder, while people are thinking for a minute, we won't rush through. If you want to ask a question, you're welcome to use the chat. We have some team members who will make sure we see that, or you can raise your hand and we'll make sure that you can come off mute and ask it that way. While we give another minute to think if there's any questions, I do want to share this slide, and this will be available too, but just some additional resources as you want to review some of the things that we already shared, or any of those pieces more in depth. And then I'll just draw your attention. The very last link there is again directly to the Lake County Behavioral Health Services website, and resources are available there too. So continuing to have that local connection in and seeing those resources there.
We just added yesterday on that page the entire text of SB 326. It's 155 pages. Probably didn't realize you were voting on 155 pages when you went to the polls, but it's pretty comprehensive of what Proposition really is. Proposition 1 really is, or was, and so encourage you to go to our page, take a look at things, and see what you think.
An internal deadline for when we'll decide. I would say by the end of the calendar year, for sure, we would need to make that decision. And in order to do that, if we're not already planning on it, we should present on our current programs and the funding structure of those programs. Knows how programs are currently funded and how that would change if we weren't able to obtain the exemption. I think that would be valuable to have here for future consideration.
Right. I want to read something, this from the, as I mentioned previously, the text of the 326, SB 326. It says, commencing in 2026-2029, so that's the next 3-year plan, would be fiscal year's county integrated plan pursuant to section 5963.02 and ongoing thereafter, for counties with a population of less than 200,000 people, which that's us. The State Department of Health Care Services shall establish criteria and a process for approving county requests for exemption from the funding that we just described. That considers factors including a county's homeless population, the number of individuals receiving Medi-Cal specialty behavioral health services or substance abuse disorder treatment services in another county, and other factors as determined by the State Department of Healthcare Services. The State Department of Healthcare Services, the State Department of Healthcare Services shall collaborate with the California State Association of Counties and the County Behavioral Health Directors Association, for which Elise is a member of that, on reasonable criteria for those requests and a timely and efficient exemption process. So essentially, they have not developed criteria for the exemption process yet. That is something that still needs to take place. Fortunately, they're looking for feedback from counties and behavioral health directors into that process. So, you know, until that is determined, we're not sure how to do the exemption process. Okay.
All right, just a quick check. Paulina, any questions in the chat that we've missed?
No questions as of now.
Thank you. All right, well, we're gonna keep moving on. If something comes to mind, feel free to put it in the chat. We'll also have breakout rooms and discussion and some sharing at the end too. So not your only opportunity to ask questions. So with that though, we are gonna move to this year's community planning process, community needs assessment key findings. And I'm going to hand over to Jamie, who's gonna walk us through what we heard from community program planning meeting 1 and the survey and what that is looking like. So Jamie, I'll mute and hand over to you and let me know as I'll try to follow the slides, but let me know if I don't move them fast enough.
Thank you. And you can go to the next slide. Okay. So as Courtney mentioned, so this needs assessment finding is based on some of the feedback that we heard in the first community meeting. For folks that were there, we did some breakout group discussions and asked some questions about the strengths of Lake County system, any needs and the challenges and any kind of unmet needs. And then we also, and that happened on January 25th, and we had 53 participants, not including ourselves that are facilitating. And then we also had a community survey that was available online as well as in paper at the peer support centers and maybe some other locations throughout the county. And that was open for about a month. We had 114 stakeholders, and that survey was comprised of 13 Likert scale questions and then 4 open-ended responses. So we'll kind of also show you the data from that. And those open-ended questions were combined with the feedback that we heard from the first community meeting, as well as at the end of this, there's a feedback survey. And some people left some more substantive comments in there that we also incorporated in the analysis. So far to date is as part of the stakeholder participation, we've had 167 folks through those 2 different venues. And that's kind of also the number of people that we had information for the findings. The graph on the right is showing kind of the breakdown of who was participating. And just wanted to note that some people, so this information is coming from the demographic survey that we asked people to fill out at the beginning of these meetings. There was also a demographic survey attached to the survey. So again, this is just, this is also why we're asking for that information. It really helps us understand who's participating, and also allows us to potentially look at differences in responses across stakeholder groups. So just another plug for kind of filling out that demographic survey. But so as you can see, this is kind of combining the meeting participants and survey participants. And we had about a third each of behavioral health providers. This is including Lake County behavioral health service providers, as well as service providers, maybe from different CBOs or operating within different organizations within the county. We also had about a third total of family members and consumers. And then we also had about a third of other community stakeholders. And this is including medical and healthcare professionals. We had consumer advocates, we had social service providers, educators, folks from legal systems or justice systems. We had law enforcement, probation, veteran service providers, just folks who identified as interested community members, and then some folks who identified as kind of other stakeholders. And then we had about 20% who didn't complete the demographic survey, so we didn't have their stakeholder affiliation. Most of those were from the meeting, the first community meeting. All right, and now we can get.
I really do appreciate that. That's a really good breakdown. A really good breakdown. It's one of the best I've seen. We have, some a good equal amount of the community, people that are invested in behavioral health, particularly grateful for the consumers and family members who've participated, really because these services are about you. Having your feedback is really super important.
Okay, and before we get in and actually show the findings, so because we did have this kind of breakdown of stakeholders where we had about a third of behavioral health providers, about a third of consumers and family members, and about a third of other community stakeholders, and this is just for the survey findings, we were actually able to look at differences in responses across these different groups. And one of the things that we kind of found, and as we go through the data, just kind of keep this in mind, was that we were hearing from behavioral health service providers that and let me step back for a second. So in the communities, in the survey, like I said, there's 13 Likert scale questions, and there was a series of statements that we asked folks if they felt that these statements were mostly or very true, a little bit or not true, or they didn't know. So we found that behavioral health providers, when responding to these questions, were more likely to kind of find these statements as very true or mostly true. And this was telling us that behavioral health providers kind of had maybe a more positive experience or outlook kind of on behavioral health services, including their experience, access, and whether services are meeting the community's needs. Overall, we kind of heard the opposite trend from consumers and family members, where for the most part, they felt that these statements were a little bit or not true, kind of showing us that there was maybe more of a negative experience of not feeling like these services are meeting the community's needs, that they're not easy to access, and maybe having a little bit of a different service experience. From this other community stakeholder group, the results were pretty mixed. On some aspects, we found that they were rating things more positively, especially around like service experience, whereas things about access or whether services were meeting the community's needs tended to be a little bit more negative, and things were split a little bit closer to 50-50 on those. Other community stakeholders were also more likely to report that they didn't know or the questions were not applicable. So on this next slide, we'll actually show you the survey data. So I know that this is really tiny and it's probably hard to see, especially on the slides, but we'll kind of walk you through. So this graph is showing each question or each Likert scale or each statement, and then the responses that we got overall. The green is showing the percent of folks who responded saying that they felt the statement was very true or mostly true, whereas the yellow is showing the percent of folks who felt like the statement was a little bit or not at all true. And the gray is showing folks that said that they didn't know or felt like the statement was not applicable. And overall, I think what we're seeing is that there's kind of some mixed responses and that there's kind of strengths and challenges in each area. And when we get into the qualitative findings, we'll be able to explore that a little bit more. But in the first service domain, this was asking about questions about the lake services that are provided. And what we kind of saw, so this first question is saying that Lake County's peer support services meet the service and resource needs of the population they serve. And we saw here that about half of overall respondents felt like this was very or mostly true, and about 40% felt like this wasn't true. When we look at the other kind of questions asking about whether prevention and intervention services help people before they develop serious mental illness, if services meet the needs of people experiencing a mental health crisis, or if behavioral health services meet the community needs, we kind of have a less positive response with about 30% of folks agreeing with those statements. And anywhere from kind of 50 to 60% saying that they didn't feel like these statements are true. And again, kind of what we saw is that providers were more likely to rate these statements as true, whereas consumers and family members and other stakeholders were more likely to kind of rate these responses as not being true. When we look at access to services, again, pretty split on people saying that they know who to call or where to go if somebody needs support, with about half saying that they did and about half saying that they didn't. Again, this trend of kind of providers saying that they did know where to go, and also other stakeholders saying that they did know where to go, and consumers and family members being more on the side of not knowing where to go. For these other ones of Lake's mental health services being at convenient locations or convenient times, or being easy to get a mental health appointment when somebody needs one. For those, we're seeing about 25 to 40% agreeing with those statements, and the majority of folks really kind of feeling that these statements weren't true. With experience with LCBH services, overall within this group, the responses were a little bit more positive. We're seeing a higher proportion compared to the other groups of people agreeing with these statements. With half saying that they do feel like mental health services support clients' wellness and recovery, and about 40% kind of disagreeing with this statement. And for the other ones of Lake County's mental health services being respectful of clients' culture, being welcoming, mental health providers working together to coordinate services, and Lake County's clients or family members being involved in decisions about their care. We have about 40 to 50% agreeing with those statements, and about 30 to 40% disagreeing with those statements. And on the next slide, we'll show, so these are just some of the examples. So these were 3 domains or 3 questions within each of those different domains that we just showed you that kind of highlight the differences that we were seeing across stakeholders. And these are 3 of the areas where we actually saw the biggest differences between what we were hearing from providers and consumers and family members and other stakeholders. So just to kind of orient you to these graphs, the kind of within each row, the brighter or the highlighted section is where we're seeing the majority of responses across each stakeholder group. So in this first question about Lake County services meeting the needs of someone experiencing a mental health crisis, we're seeing that 55% of providers felt like this statement was true, compared to only 14% of consumers and family members, or 30% of stakeholders. And for what we actually saw from consumers and family members was that 81% felt like this statement was only a little bit or not true, and 57% of other stakeholders felt this statement was not true. For the next question, I know who to call or where to go. Again, we're seeing most providers felt like this was true, and a little over half of other stakeholders felt like this was true. But on the other side, for consumers and family members, we're seeing over half of them felt like this statement was not true. And for the last question, Lake County's mental health services support clients' wellness and recovery. Again, we're seeing most providers feel like this statement is true. About half of other stakeholders feel like this is true. A relatively high percent, 20% saying that that they don't know. And then for consumers and families, again, we're seeing the majority of them saying that the statement was a little bit or not true. So that's just kind of highlighting some of the differences that we were seeing. These next grouping of slides, this is kind of the qualitative information that we gleaned from that first community meeting discussions, also the open-ended responses from the survey, and then also some of the information we got from the survey or from the meeting feedback form. So first, looking at LCBHS system strengths, one of the things that we heard is that over the last few years, Lake has really put a lot of energy into providing a wider variety of service options, and that people really appreciated this. One of the quotes was from somebody at the first meeting was saying, "I'm really impressed with the energy that is in the county around behavioral health interventions. I'm impressed with the team and progress that is being made." Similarly, people felt like there was momentum among stakeholders of really embracing and implementing new services. Another strength that we heard was really around the staff and leadership, and feeling like the staff and leadership are caring, they're dedicated, they're hardworking. One of the survey participants said, "I have even greater appreciation for excellence in leadership. I'm completely sympathetic toward all the humans who keep this ship afloat." As we saw in the survey, there are kind of mixed experiences around service access, with clearly some challenges, at least being felt by consumers and family members. So what we heard through the survey and the community meeting and feedback form is that when services are helpful is when they are accessible, when they're consistent, and when they really try and meet clients where they are. And to that end, we also heard that people really appreciate when programs are flexible with providing both in-person and virtual service options, and that this kind of helps people access and engage in those services. We also heard specifically about a couple of programs that were mentioned or highlighted as being like particularly helpful or useful programs. And some of those were the peer support centers, full service partnership or FSP, some of the housing supports, outpatient services, crisis services, and also outreach services. So moving on to challenges. So the first kind of area where we heard some challenges and persistent needs were about just difficulties with staff shortages and also staff retention. And hearing that there are several programs that are short-staffed and underfunded, and that the short staffing and kind of underfunding can then overwhelm staff and also lead to staff burnout, which then can also contribute to staff turnover. And that kind of staff burnout and staff turnover and being short staff can also impact service delivery and then ultimately the client experience. So as one survey participant said, my patients are hanging out in the wind, our volume has increased and services are limited. We also heard about some of the barriers to accessing and participating in services. So in some cases, people talked about insufficient service availability of just not having, even though some of the crisis services maybe were seen as helpful, there just aren't enough of these services, particularly crisis and prevention. As one survey participant said, when reaching out for preventative services, people are turned away for not being a critical enough situation. If you can't get services until you're in severe crisis, there's no prevention happening. Even when in critical crisis, getting services seems impossible. Also, the timeliness of services, people felt like they were experiencing long wait times to get into care when they needed it. And some other kind of service access challenges that we heard were limited operating hours, with some programs only operating during business hours. So maybe like 8 to 4, 8 to 5 on Monday through Friday, which can be difficult for people who have jobs or can't take time off to get to those appointments. Also transportation difficulties, people talking about not having transportation or not having easy enough access to transportation, and they can be hard to get to different services. We also heard about insurance types. So sometimes maybe there being an insurance mismatch with programs, of maybe some programs not accepting private insurance, or on the other hand, some programs not accepting Medi-Cal or other public insurance. We also heard about housing challenges and there being unmet needs. So not just not having enough housing, but then insufficient kind of affordable housing, safe housing, and clean housing. And then not having enough housing, but then also not having enough kind of safe housing options can also impact mental health. And then with some specific services, we also heard the need for more peer support centers and also some substance use services like detox and medication-assisted substance use treatment. For the next slide, so we also asked about some of the specific populations that are in need or have unmet needs. And one of the things we heard was around older adults, that there's insufficient services for this population, but also that they're harder to reach. That isolation and structural issues can make it difficult to serve these folks, especially if they're homebound, they have a disability, or maybe they don't have family that can support them and kind of help them get to services. We also heard about the LGBTQ+ community as being underserved and not having enough resources available specifically for that population. Also the unhoused population, again, not enough services available, and that in some cases, linkages to services aren't happening fast enough or kind of in those moments when people need immediate care. And then the last population that we heard was individuals transitioning from incarceration, so from jail or from prison, and hearing that there's not enough resources when people are being released and kind of exiting to the community, and to help them kind of reintegrate and re-enter into the community. And that during this time, it's a vulnerable time. And without that kind of like additional support, that people could be more at risk for experiencing mental health crisis. And two of the quotes that we heard, the first one around older adults, that needs for older adults, caregivers, and service providers are completely lacking, partly due to system structure, but also due to disconnect with advocates and organizations serving older disabled adults. And the other quote one of the other quotes that we heard is, most people get jailed and released back to the public without anything. And then for the next slide, we also asked about if if folks saw opportunities or had ideas about how to address some of these challenges and needs that we've been seeing. So one of the first ones was just about offering later appointment times for those people who are working during regular business hours or can't get off. Encouraging more mental health providers to provide services out in the community, and again, kind of meet people where they are and increase that access. Establishing more programs and locations along bus routes so that they are easier to access with public transportation. Doing more to support staff and making services more welcoming. Providing more training opportunities for employees. Doing more to create more diverse leadership and management. And then lastly, improving collaboration and communication across providers and partners. And again, two of the kind of illustrative quotes that we heard was, there's a need for public information and outreach so that people know who to contact for the appropriate level of care to avoid frustration and feeling that nobody will help. And then another survey participant said, diverse leadership is real inclusion. And then for the next slide, so I'm actually going to hand this over to Scott, and I think maybe Elise, to kind of talk through some of the things that Lake has been doing to address some of these challenges that we've been hearing.
Sure. Thank you. So this is a very information-filled survey, as you can tell. Couple things about it. You know, it was given, as mentioned earlier, this information was collected right toward the beginning of the year. And we also happen to be going through a tremendous amount of change. We've talked about Proposition 1. That's just one of many changes that our department and the field are going through across the state. We also have payment reform in the form of CalAIM and how we are billing for services, and even providing services which go along with that. With that goes a lot of different new things that we are being asked to do, and we're really making a good effort to do those. On this list right here is some things that we are doing, which I think will affect some of those concerns that came up previously. One of the things that stood out for me a lot was, I think it was called the lack of information sharing that was mentioned, and I think that's extremely significant. You know, because we can provide services, but if no one knows about them, you know, that could be problematic. You know, if we're not getting the word out of what we're doing, what we're offering, then people won't be aware of the resources that we have that are available. So one thing that we have done to address that, and I don't think we have it actually in this section, is we now have a staff person who their specialty is to be that community liaison, to be able to do that, you know, to reach out to the community, to, you know, find out what's going on with them, but also to inform what we have available, particularly through things like social media and other media campaigns, to be able to kind of get that word out. For example, I don't know if anyone's noticed, we have a billboard now up in Upper Lake, you know, directing where crisis services are available. One of the, and speaking of crisis services, one of the major, I mean, I can't understate major, changes that's been implemented is mobile crisis, which means this is essentially outreach crisis where our staff, new staff, is going out, and this is started at the beginning of the year, going out and responding to crises as we become aware through dispatch. So in a lot of ways, we are replacing traditional first responders such as law enforcement, the police departments and the sheriffs, of going out to potentially relationship and mental health crises, and providing services right where the crisis is at. As you can, just from my description, you can see that's a huge change that's going across the state. Elise, I don't know if you have anything you'd like to add to that.
I do. I mean, I don't think that a lot of these, Kevin, I see your hand. Let's go ahead and take your question.
It wasn't a question as much as I just wanted to say, seeing the difference working at a healthcare clinic. Clay has come in crisis services quite a few times, and it's been really so supportive to our staff. We really appreciate that collaboration with LCBHS.
Right on, Kevin. I appreciate
Thanks,
that.
Kevin.
So I don't know that it's gonna make anybody feel better, but these issues are not unique to Lake County. And so I do have a position where I'm able to, I guess, connect with other behavioral health directors and stay in touch with statewide how things are going. And these issues are fairly universal. And so that's the largest reason why the California Advancing and Innovating Medi-Cal initiative has been pushed out, is because of a recognition of gaps such as these. I do want to put in the chat that regarding justice involved services, we are aware of jails pretty much since the closure of the state hospitals, which precipitated the original MHSA, right? That jails are a de facto mental health facility. That's not news to anybody. We know that that population has been underserved. So to address that, DHCS has issued several grants to build capacity around that. We were just awarded round 3 of this grant that's going to do a lot of work around transition planning, so that when people do exit the jail or a carceral setting, they aren't just dropped off into nothing, because we know that just sets up a revolving door. And our partners over at the jail, the sheriff's office on the custody side, are very supportive. And so that's one of the specific areas that we are aware there's a deficit, but again, it's a statewide deficit, hence the statewide funding opportunity. Our allocation at one, I think it was like $850,000 to stand up better services for people exiting carceral settings. And before I go on, Meredith, I see your hand up.
I just wanted to share that our experience so far with the mobile crisis has been fantastic, has been phenomenal. We actually had a response out at the probation department that was quick and that was really good and efficient. So just want to share that. It was really good.
Right on. I appreciate that feedback.
Yeah, and we're trying to share it as well and utilize it as much as possible, as needed anyway, but it's been great.
So thank you for highlighting that. And so the deal with that benefit, which of course is a brand new benefit effective January 1st, incidentally, and I will brag about this, Lake had the first approved implementation plan for this service in the state of California. So we were very motivated to launch this service. We recognized that was a huge need in our community. And just so we're level setting here, that means that you call this number and a crisis team of 2 people will come to you wherever you are. And that is for substance use crises and mental health crises. It's a behavioral health wide multi-system. So if you're someone are struggling, you feel like you're relapsing or having an issue with substances or struggling around that, that's eligible for the mobile crisis benefit as well. So it's inclusive in that way. And that's the way, as you can see with the transformation from the MHSA to the Behavioral Health Services Act, there's a big push on integrating systems, which is very welcome, and we support that. So I want to say, we take this feedback very seriously. It's very valuable to us. We have done a lot in the past couple of months, even since this survey was initiated, to address some of our access issues, because we knew that there were access issues. So to that end, we've onboarded and worked even more closely with some of our contracted providers to expand access services, with the goal of getting people same-day assessment and into services. So we're trying our best to streamline that process. We do not want access to services to be a barrier. We're trying to shorten, bring on providers to shorten any wait times for services, and continuing to expand our contracted provider network to ensure that we have the capacity to meet the demands of the community. I think, Scott highlighted our efforts to improve our community communication around services, because I still find that a lot of folks don't know who we are and what we do. And so again, one full-time employee whose only job is just to do that kind of work. It is not finished, it will never be, but I also want to highlight that we're doing our best and moving a lot of work forward around coordinating and collaborating with our other healthcare providers and partners in the community, such as our federally qualified healthcare centers. That includes Adventist Center, Tribal Health. I don't want to forget Side Health Center. So as a healthcare collective in the community serving these needs, we're really trying to honor the no wrong door, where you can go anywhere and get the services that you need. And it isn't perfect, but it is evolving. And we're just, again, taking this feedback very much to heart and trying to provide just world-class services to our beneficiaries in Lake County, because we deserve that.
Yep. So thank you very much. As you can tell, a lot of change is taking place in our department, in as Elise said, across the state, across the field, that we are really, some huge changes are coming about. They're exciting changes. They're changes which are designed to help communities. Even Proposition 1 was designed to help the community. It will help the community, particularly the bond measures. There's been a dearth of treatment beds that have been available, and that will take some time to implement those bond measures and creating those treatment beds. But that is something that's been desperately needed for a long period of time. And so there's change. I've been associated with Lake County Behavioral Health since 1998, and this is, or 1999, I'm sorry, 1999, and this is the most change I've seen at once during all that time. So it's an exciting time, but as change comes, change can sometimes be difficult. And we've experienced our own hiccups in that process, but we're progressing forward. Having your input into that is vital. And so thank you for being here. Jamie, I'll turn it back over to you.
I think that might actually conclude this section, unless there's anything else that you want to share.
I don't think that if there's any questions anyone has of what we just talked about, we would certainly entertain them at this point.
Great. Thank you, Scott and Elise and Jamie, for having that conversation. We'll pause just for a moment in case there's a question that needs to come forward. But as we pause, we are moving into the part of our meeting where we will have some opportunity to go into breakout rooms and have some conversation more in depth about what we just heard, what was shared through the community needs assessment. We have some prompts and questions to kind of guide that time, but just to even dig a little bit deeper, identify what you heard that you would add something to, or if there feels like there's something missing. So we'll have both of those opportunities. Before we move into those discussion groups, we are going to take a 5-minute stretch break and let everybody reposition or get some water, or just reflect on all of the information that was shared. And so we will pause here till about 11:20, so just about 5.5, 6 minutes. And then we'll come back and move right into breakout rooms and have opportunity for that sharing and discussion. So I don't think, did anything else get posted in the chat that we need to address now before we go to break? Okay, great. Well, we will see you back at 11:20. But yes, take a stretch break or just ready for conversation to come. Thank you.
And you could be one of the fellas, and that is almost like the, but because you can have structure out here, but you have to work. Yeah, you have to. You don't know how to do that. You don't know how to do it, not learn. You have to learn.
We're about 11:20, so I'll just hold for a minute as people come back to the meeting room, and then we'll go over discussion questions before we go into breakout spaces. We'll also have them again for you in those breakout spaces, but we'll just kind of review those here briefly. Okay. Well, welcome back. And just a note, if you missed it as we went out to break, but Paulina did share again that demographic survey in the chat. As Jamie mentioned during needs assessment, the feedback that we get there helps us further look at the information coming in and who is sharing information and how services and programs and decisions are impacting different community members and groups differently. So that is there if you have not had a chance yet during this meeting to fill that out. But with that, we are moving into our time of breakout discussion. And so an opportunity to reflect on any of the things that were shared today. We are specifically going to focus in on the needs assessment, but also opportunity to think about Mental Health Services Act overview or Proposition 1 sharing. All of those things are welcome to bring forward. Again, we will have these questions with us in the breakout space and be able to share them, but going to reflect on what about the needs assessment themes and findings stood out to you. So if there's anything that really kind of resonated or stood out with you, is there any that you think should be highlighted, but maybe you didn't see? So any community needs that you want to continue to elevate. And then some of those needs assessment themes and findings, is there additional context or experience or information that you might provide to them? And we have a few questions to ask there as well. And then thinking about those community needs and the themes and the finding, what community needs or noted opportunities for improvement do you think are and feel are most urgent for the upcoming year? So those will be the questions that we take into the breakout spaces with us. We'll have about 20-25 minutes there, and each space will have either myself or Jamie and Paulina to facilitate. We will be taking some notes just of those broad things that were shared in those spaces, and that gets added back into this needs assessment and continues to inform program planning for upcoming years. Okay, I am going to open breakout rooms. Patty, I think I have everybody in a breakout room. If anyone is left in the main room, can I ask that you just assign them to either one? They're fairly even spaced right now, so you can send to either room.
Yes, I can do that.
Awesome. Thank you so much. Okay. All right, welcome back. I'm just going to give a few minutes to let everyone get back in the room and reshare slides, and we will continue to move forward. Sorry, too many screens. Okay. Can someone just let me know, thumbs up if they were seeing slides again?
Slides.
Okay, perfect. Thank you so much. All right. Well, we are close to the end of our meeting, but I think we'll do this quickly so we have time to talk about next steps as well. But let's just spend a few minutes hearing and kind of high level what happened in each breakout room. And I think for sake of time, Jamie or Paulina, I'll have you come up and just maybe share 2 to 4 things that came up in the meeting or any key themes that you would want to share back in this room, and then I can do the same for our group.
Yeah, so one of the things that kind of we started with was what just surprised folks. And one of the things I think was just hearing some of the information around access, of some of that being surprising, but also hearing appreciation for Lake and being able to take some of this feedback and really make use of it, and take it seriously and make some adjustments. And, you know, just noting that there are some things that are already being worked on. When it came to either some needs or like opportunities for improvement, talked about really finding ways to increase engagement and participation in services, like thinking about things like incentives of having food or other resources available. Also transportation, that there are opportunities for for programs to provide transportation, or through insurance programs like partnership, people can get transportation. Some of the kind of needs that we heard with children and families, that a lot of times those preventive services are for like children and teen, but that 0 to 5 population is kind of underrepresented, and there should be more programs for those folks. Also looking at housing, and then we talked a lot about kind of some other like substance use programs, of, you know, substance use residential treatment programs that allow children to stay, sober living environments for families, and also kind of more housing services and services for adult males. So that's another population that can kind of be underserved, because services a lot of times kind of focus on families and moms. So that's kind of a high level. Paulina, is there anything that you would add? Great. Then I will kick it back over to you, Courtney.
All right, thanks, Jamie. And just to note for everyone, the conversations that we're having, we were taking notes in those breakout rooms. Those will be shared back. So those were definitely meaningful spaces to share, and we appreciate that. Some similar themes that came from the other discussion space, I think similarly, just kind of reflecting on a lot of appreciation for the continued just innovation, work, improvement, and kind of community care that Lake County Behavioral Health Services and team have already been doing, and even the timing of some of the survey work that went out, how access services and community crisis services have increased and continued to meet community needs in new ways since that time. And so I think that conversation kind of kicked us off. I think a lot of our conversation there that feels maybe adding to what you shared, Jamie, was looking at maybe some other areas of community needs. So highlighting foster youth and youth who might be transitioning to more permanent homes, as well as just kind of the broader conversation that evolved there around looking at support for parents, families, those primary supportive people in a youth's life, child's life. So services sometimes are really being focused on the child and not maybe being as available to the family. So finding that bridge to have that kind of full wraparound resiliency. And then in that even kind of brought in the population of individuals re-entering community after incarceration, and that same thing, whether it be a formal family member or it's a primary friend, support person, but someone in that individual or individuals' lives also being able to have supports and services and abilities to support their individual and their loved one who is actively addressing mental health and behavioral health challenges. And so I think there's a lot of conversation of seeing some really good foundation pieces being put in place for that over the last handful of months, but where can that continue to grow and evolve in community support? I think with that, Scott, I know you got to jump between the groups. Is there anything that you would want to call out or add to that sharing from the group conversations?
No, I don't think so. You know, I think the feedback, I really do appreciate the feedback, and it gets me thinking, you know, where we need to go, based on that feedback. One thing, as I mentioned so group number 2 is, I'm really thinking about what we should do is particularly with our forensic program and our older adult program, is fold them into our full service partnership program. They would still be those programs. They'd still be a forensic program. They'd still be an older adult program, but they'd have an FSP component to them, which would would make them stronger to be able to provide, more robust service as a result. It did strike me quite a bit, that there was concern, from our surveys about, for our older adults and our folks that are getting out of incarceration. So I think, being able to strengthen that, I think will something that reflects that feedback that we received.
Thanks, Scott. So I know that we're close to noon here, so just to kind of wrap us up as we end the meeting today and share some reminders of what to expect next. So we've been in this community program planning period, conducting needs assessment, getting community feedback. We'll go back to that based on conversations today and add in some of that content that was shared. But what are the next things that are happening with the development of the annual plan? And so here, as we head into April, is really developing that out, identifying and summarizing the program happening, successes, things that were taking place, looking forward of what will happen in 24 to 25. In May, that annual update will be posted for public comment. And so early May, that plan will be posted on the Lake County Behavioral Health Services website. You'll see it in posting in newspapers, but there will be a 30-day public comment period where that is available to review and submit any feedback that you might have. And then at early part of June, there will be a public hearing. And that will be, again, an opportunity to, one, close that public comment period, but also have a opportunity to voice anything that you might have feedback about or continue to ask questions about the process. And then finally, as we close today, we'll put this in the link, but we always are looking at ways that even the community planning process, these meetings can continue to evolve and improve and really meet community needs of being able to inform annual updates and 3-year plans. So we have a short survey with just a couple questions that is being placed in the chat. So if you have opportunity to take that as you head out today, you can use the QR code. And then for everyone who are at peer support centers, again, you can use the link or the QR code. You also have that survey in a hard copy, paper copy there at each center that you can complete today. And also one more final plug, if you haven't done the demographic survey, if you can do that as well, please. Okay. With that, I'll hand back to Scott or Elise if there's anything else you'd like to say in closing. But from RDA, thank you so much for a really rich and participatory meeting today. We appreciate that. Scott, anything else from Lake?
Well, I mean, not one, like I said, our next step will be putting together the plan. And, we will be contacting the community again for feedback of that plan. That'll be at for you all, that'll be our public hearing, which will be coming up, and that'll be, kind of the last meeting that we'll have for this particular update. If you have any other feedback between now and then, please let us know. You can see our email addresses are there on the slide. You can also just give me a call if you'd like to too. But again, as I said at the beginning, thank you for your time. Super appreciate you being here. I know you all have busy schedules, but I also am super impressed and happy that you see the value of being here to help guide our Behavioral Health Services Act, as now we'll be calling it. So it's great having you here. And we hope you will continue helping us. Thank you.
Great. Thanks, Scott. Well said. All right. Well, with that, thank you so much for attending today. Have a great afternoon.